Yeah, you can come in.
Hi, how are you?
I'm good. How about you?
I'm good. I am Cecilia Irish, and I'm going to be your student nurse from Detroit Mercy, giving you a head-to-toe assessment. And what is your name?
Alina.
And what is your date of birth?
January 16th, 95.
Okay. Do you know what today is?
Today's Thursday.
And where are you?
The hospital.
And what are you having done?
Just a checkup.
All right. So patient is alert and oriented ×3. Clear speech, appropriate responses, positive affect, posture is upright, and she is well groomed, well dressed, good overall hygiene. So do you have any pain? Are you in any pain? And do you have any allergies?
No.
Not to latex?
No.
Okay, so no stated pain or allergies. So I'm just going to assess and inspect your skin of your head and your neck region. There are no lesions, scarring, bruising, scaling. It's warm, dry, and intact, and appropriate for ethnicity. So I'm going to have you follow this pen light. Okay. And your conjunctiva are light pink and moist, and her sclera is white. And again, just look straight ahead. I'm going to look for her pupil reaction to light. So her eyes are perla and reactive, accommodating, round. And can I have you open your mouth for me? So her buccal mucosa is pink, moist, along with her tongue. Her teeth are all intact and white. Her gums are pink and moist as well. And can I have you say ah, ah? Her uvula retracts, which is normal. Her tonsils are +1. Okay, now can I have you close your eyes for me and tell me where I'm touching?
Forehead, cheek, chin, nose.
And can I have you smile, frown, puff your cheeks? So cranial nerves 5 and 7 are intact and reactive. And I'm just going to inspect the skin of her upper extremities and arms. So again, no lesions, bruising, or scarring, appropriate for ethnicity, warm, dry, and intact. I'm going to get her brachial pulse on both sides, and it's a +2 bilaterally, and her radial pulse, a +2 bilaterally. And her capillary refill is less than 1 second, and no clubbing is present. And now I'm going to palpate for her carotid artery separately on both sides, and they were both a +2. And now I will auscultate and listen to those carotid arteries to make sure there's no bruit or other adventitious sounds with the bell. And no bruit is heard. So now I am going to auscultate and listen to her lungs in 10 places on the front and then on the back. And deep breaths in and out every time I move. And again, I did 10 places. And can I have you lift up your arms for laterally to listen to your lungs? And can I have you spin around so I can listen to your back? And again, breathe in and out in 10 different places. Okay, and spin back around for me, thank you. No adventitious sounds of the lungs, clear in all fields. And so now I'm going to listen to her heart, checking for normal heart rate. So right here I'm listening to her aortic, her pulmonic, her herbs, her tricuspid, and her mitral, which I would listen to for a minute for the apical rate and flip it over to the bell and listen back. The mitral, tricuspid, the herbs, the pulmonic, and the aortic. So S1 and S2 were normal, no murmurs or other adventitious sounds. And can I have you lay down for me? So now I'm going to assess her abdomen, IAPP, inspect, auscultate, percuss, and palpate. So just inspecting, her umbilicus is midline, her contour is flat. And so now I am going to auscultate and listen in 4 quadrants to make sure normal paralysis. And normal bowel sounds were heard. So naming the organs in the 4 quadrants, in her right upper would be her liver, her gallbladder, her head of the pancreas, and her kidney. And in the left upper would be her stomach, her spleen, the tail of the pancreas, and her other kidney. And in both lower quadrants, left and right, would be her ureters and her ovaries. And the right lower would be her appendix. And then here we have the ascending colon, transverse, descending, and sigmoid. Okay, so now I'm going to percuss, looking for tympani. And does this hurt at all? No? Alright, and now I'm just going to lightly palpate, and this doesn't hurt, does it? No? Alright. So her abdomen was good. Now I'm going to go on and assess her skin of her lower extremities and her legs. No edema in the lower legs. No lesions, scarring. Appropriate for ethnicity, warm, dry, and intact. Now I'm going to get her popliteal pulse, which is a +1 bilaterally, and her posterior tibialis, which is a +1 bilaterally. And can I take off your socks?
Yeah.
And her dorsalis pedis pulse is +1 bilaterally. And assessing her capillary refill on all toes, less than 1 second, and just lightly grazing the bottom of her foot for the Babinski, and there was no fanning of the feet. And can I have you stand up for me?
Yeah.
Do you feel dizzy?
No.
So no jugular vein distension either. And can I have you close your eyes and testing her Romberg? And negative, she is steady. And can I have you walk to the door and back? So posture is appropriate while walking, good gait, very stable. All right, and her anterior to posterior diameter is 2 to 1. And then can I have you bend over and I'm going to assess your spine. And your spine is straight. All right, good. And I'm just going to lightly percuss your kidneys. Does that hurt?
No.
Okay, so her kidneys are not tender on her vertebral angle. And do you have any other questions?
No.
All right, you're all set.